So you would know if you needed a hip replacement. Well, number one, you would start having pain, right, with certain activities or every day or whatnot. The hip, a lot of people get confused with where the hip actually is from an anatomy standpoint. A lot of people come to see me and think the hip is like this big region on the side of your kind of your buttocks area and in the front. In all honesty, your hip is really in the front of your groin. So a lot of patients, once you start having pain that's in the groin, that typically is in the hip. Once that happens, most patients will at least go see their primary care doc, maybe go to an emergency department or urgent care or see somebody where they'll have an x-ray done. The x-ray is kind of the first step of diagnosing what's actually going on. You could be having hip pain in that area from a lot of different things. But once you get an x-ray and there are signs of arthritis, most primary care docs, non-op sports docs can treat you conservatively with the anti-inflammatories, rest, activity modification, diet, and activity, all those things. Once the hip gets bad enough, or the PCP or maybe your non-op sports doc thinks that you've gone too far, that they can't treat you anymore with the conservative stuff, they may send you to an orthopedic surgeon. And then that's really kind of where you start to have the discussion with, what are my options? Is surgery an option for me? Do you think surgery is a good option for me? And you kind of go through all those discussions.